Hello. Hi, my name is Dr. Surafel from Ethiopia, Gondar. Today we are going to see some points about how the oral and maxillofascial skeletal fractures are happening. So we're going to see specifically the kinematics of the fracture or the hard tissue injury, which is obviously the bone or the skeletal injury. So the first thing we humans have, or the maxillofacial structures does have its own tensile strengths. So tensile strengths we do have. And the other thing is it's the state of movement, which is called the momentum. Momentum. So any change in this state, any force which is applied to affect this state, it's called an impulse. Impulse. So whenever there is a change in momentum, there will be a kinetic energy. So we do have kinetic energy. Once we have kinetic energy, this kinetic energy will generate a new work, the work done, or any change in the way that is a fracture, a compression, or a shear, or a tensile strength or tensile strain. So many more factors will lead to a development of a strain. Once the force is applied over that area, there will be feeling or experience of a strain to that specific particular object. So change in kinetic energy equals to the work done. So how are we going to have this kinetic energy cause this work done? So the next topic, we're gonna see some kinds of or types of strain which is impacted on a specific object or specific part of the skeleton. So the first one will be tensile strain. Second one will be shear strain. The third one will be compressive strain. And the fourth, but not the last, will be overpressure. So tensile strain, it is when force is applied and the single object will just disjunct or separate in the same axis but in a different direction. So the force applied will be perpendicular or in a different axis to the displacement of the objects. So tensile strain will be, it's just, this is object, it is just going like this, and the force will be here, and this is the same axis but it's perpendicular to the previous object. This is called tensile strain. The second one will be shear strain. The shear strain, this is just similar with that, but the force applied will be in the same axis but in the opposite direction with that of the force applied. So this is the same object, but this object will be, whenever there is a force, especially most commonly, diagonally applied force will cause such kind of strain. And also the tensile strength of the object also matters. So here, this object will go like this, and the disjunction will happen here. It's shear strain, and it causes a devastating injury, especially for soft tissues and the neurovascular structures. They will get devitalized. Ragged edges, those kind of injuries are secondary to such kind of strain. And the third strain will be compressive strain. Compressive strain is just a different entity whenever a force is applied, or this is a car which is going and the force will be applied, and there will be deformation. So it just causes a deformation of certain object. That means work is done. That means there is a force and there is a displacement of certain object. Deformation of the material. This is called compressive stress. And the last is overpressure. It is just an injury which is just occurring in a fluid field or an airfield sac. So this is more serious damage in case of a thoracoabdominal injury and brain injury especially, causing the uniform dispersion or distribution of the force all over the cranial vault, and those all forces are just concentrated at the center and causing a devastating injury for the reticular formation, the amygdala, and the basal ganglia. So those conditions are seriously concerned. So this is how we sustain an injury. Thank you. Like, follow, share, subscribe. Don't forget to subscribe.